All right. Hi, my name is Ben. I'm going to be your
Okay.
nurse today. What's your name?
John Richard,
John Rashad. What's your date of birth?
4896.
All right. I'm going to check your ID band. That looks correct. You have good speech. No stuttering. No problems with speech.
Thank you.
Right off the bat, I see there's no signs of trauma, respiratory distress, no accessory use of muscles, no JVD. Do you know where you are today?
Northeastern.
Northeastern. And what day is it?
It's Friday,
And what year is it?
2018.
So he's alert and oriented. I don't see anything off the bat with his head, his scalp, no dry skin. He looks well groomed, good hygiene. I'm going to check his pupil reactivity to light. So right now they're at a 3. So look straight ahead of me, right at my nose. There you go. All right, they're at a 3 and they constrict to a 2 and go back to baseline. Next, I'm going to check your cardinal gaze. So just look right at the pen. Don't move your head, okay? Excellent. No stuttering, nystagmus. And then light reflex. Look straight ahead of my nose. Don't look at the light. And it is intact. Excellent. Now, open your mouth for me, please. Stick out your tongue. All right, no sores, lesions, good hydration, lips are not cracked, teeth are all there, mucous membranes are pink and moist. Excellent. Are you able to swallow?
I am.
Excellent, perfect. All right, next, check your ears. No pain or anything, right?
Nope.
No tenderness?
None.
All right, check his occipital, lymph nodes, post-auricular, pre-auricular, parotid, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. No tenderness or any on palpation.
None.
They're all soft. No problems there. Excellent. Now, I want you to shrug your shoulders up for me, please. Good job. Good job. All right. You want to stick your arms out for me? Feeling muscle, good muscle tone. Squeeze my hands. Good. Checking radial pulse. And they are symmetrical, bounding, even. Good. Check cap refill. Less than 2 seconds. Good. No clubbing of the nails. You're not having any problems breathing. No chest pain. No pain anywhere else.
None.
No shortness of breath.
Nope.
Awesome. Good. All right. Next, I'm going to check your chest. Okay. I'm going to start off with lung sounds. So we're going to go to the front first. Okay. So there's 6 fields in the front. There we go. So a nice deep breath for me. Good. Nice. Good. And I'm going to go on the lateral side. Excellent job. All right. No problems with that?
None.
And no, I didn't hear any cracks, rails, wheezes, or anything like that. Nice, clear lung sounds. Next, I'm going to palpate your heart. I'm going to also take your heart sounds, okay?
Mm-hmm.
So first is your aortic valve, which is right up here on the second intercostal space, where S2 should be greater than S1, and it is. Next is this pulmonary valve, where S2 should also be greater than S1, so on the second intercostal space. It is. And Erb's point, right here in the third intercostal space. S1 and S2 should be even. And then this is this mitral at the fourth intercostal space. And tricuspid is fourth intercostal space, and S1 should be greater than S2. It is. And then find its clavicle, mid-clavicular, fifth intercostal space, It's the apex of mitral valve, and S1 should be greater than S2. It is. Excellent. I'm going to flip the bell over for any bruits. In the same exact spots. Not hearing any. Great. And now I'm going to check his carotid pulse. Either side. Nice and strong. Even. No bounding. And check with the bell. Thanks. Good. All right, you want to flip around for me?
Yep.
I'm gonna start off with his lung sounds back here. And there's 8 spots that I have to listen to. So I'm gonna look for the scabs in between, no bony prominences. His spine's right here. So take a nice deep breath for me. All right, these are the bronchioles, where expiration should be greater than inspiration. This is bronchovesicular, vestibular, where the sound should be even. And then this is the vestibular, where the sound inspiration should be greater than expiration. I'm going to listen to the lower lobes over here too. All right, no rails, wheezes, crackling, anything like that. Just nice clear lung sounds. Now I'm going to find T5. Check his chest expansion, so take a nice deep breath for me. Nice, no problems with that. Nice and even. And check his CVA tenderness. Any pain with that?
None.
Excellent. You want to spin around, lay down for me?
Yep.
Let's slide this out. There we go. Okay, first I'm going to observe, see if there's any obvious distension, deformities, any bulging. I don't see any palpitations. None are noted. Next I'm going to oscillate in each of the 4 quadrants. Listening, vowel sounds. If I don't hear any, I can listen for up to 5 minutes. Sounded good. Next I'm going to check his aortic artery. There we go. His renal arteries. Iliac arteries. It's femoral arteries. I shouldn't hear anything. Go. Excellent. So, have you been moving your bowels okay?
Oh yeah.
When was your last BM?
This morning.
This morning? Okay. Any problems with urination?
Nah.
And you've been eating?
Oh yeah.
Okay,
More
no
than I
problems with
should.
that. All right, no nausea, vomiting,
Nope.
anything like that. Okay, I'm gonna feel around a little bit. Is there any pain or tenderness?
Nope.
Good. Excellent. No pain or tenderness while I was doing that? Good. Good. Now I'm gonna do a little percussion. All 4 quadrants. All right. No pain or anything with that?
Nope.
Good. Excellent. Now I'm gonna angle this a little bit better. There you go. Kick your shoes off for me. the legs. I'm gonna feel down the legs. I'm gonna feel around here. Okay. There we go. Feel down the legs. Good muscle tone. Oh yeah. Steady cam. There we go. Okay. Hair distribution's good. No signs of cellulitis, dry skin. No signs of edema. It's not pitting at all. Go. Alright, take your socks off. I'm going to check his dorsal pedal pulses and compare them bilaterally. What you doing? There we go. And then his tibialis anterior, posterior. Compare them bilaterally. No problems. Wiggle your toes for me. Alright, toes to nose. Press the gas pedal. Alright, check cap refill.
Disgusting toes.
Yeah, kind of gross, but whatever. Alright, check cap refill. No problems here. Distribution's good. Color's good. Excellent. You want to sit here at the end for me?
Sure. Got my socks back?
Yes, you can. Put those on after, though, huh? Alright, I'm going to check your reflexes real quick. So patella tendon. Nice. Excellent. Excellent. Good job.
Thank you.
Any questions for me?
None today.
Great.